Hi, welcome to Blue Turtle Cove. Checking in?
Yes.
Would you like a single or double room?
Single.
Ocean view?
Sure.
Curtains? Soap? Shampoo? Hot water? And pillows?
Of course I want pillows. Do I have to pay extra for all those things?
Well, for only $7.50, you can bundle shampoo and conditioner.
Some things should just be standard. RevVoice has 17 standard calling features. Cut the blue wire. Get RevVoice, save money.
Good evening, Bahamas. You're tuned into NB12 Weekend, broadcasting from Cable 12 Studios on Robinson Road. Coming up tonight, the Doctors Union explains why it has yet to fully support NHI. Public clinics remediation on the horizon as the April rollout for NHI nears. A former Deputy Prime Minister says there's no end in sight for Bahamar. A Bahamian makes the most delectable looking tiny food. And as always, we count down the top quotes in news this week. I'm Paige McCartney. We've got those stories and more straight ahead on NB12 Weekend. Welcome once again to NB12. The Bahamas Doctors Union is the latest group to raise concerns about the Christie administration's National Health Insurance Scheme. As the nation's physicians and healthcare officials continue to voice concerns and call for better engagement of stakeholders, the BDU said it supports universal health care and they want to contribute to NHI, but felt it hasn't been able to do so. Union officials told NB12 although they would like to support the government fully up to this weekend, they said they can't given the lack of information and consultation. Dana Smith reports.
Dr. Dinotra Archer-Cartwright said morale among doctors is low and members of the BDU feel marginalized and taken advantage of. She said the union supports the concept of NHI, but it feels it has not been given the opportunity to appropriately contribute.
The morale amongst health workers, in particular doctors in the public sector, is extremely low. For a very long time, the doctors, especially the junior or non-consultant physicians, have been left out completely in all discussions. Although we had a discussion with the Prime Minister, since then we've been giving very little information about how NHI is going to affect all of us. We feel like that we've been marginalized, and in some aspects we feel as if we've been kind of taken advantage of because of the situation that we are in. So we want to contribute, we want to take part in moving this forward, but we haven't been given the opportunity to do so in a capacity that would make any type of good representation on behalf of our members.
Cartwright said the union has a number of concerns, including the undeniable need for infrastructure strengthening, a lack of suitable communication, transparency, and appropriate consultation, and the insufficient involvement of frontline stakeholders in NHI development. In a statement, the union also pointed to a lack of adequate staff for the expansion of services in the hurried manner of implementation, which it says proposes inappropriate planning and poor consultation with healthcare workers, despite their willingness to participate.
We also lack the appropriate staffing in order to implement this appropriately, and we feel that more needs to be put into the development of doctors and Bahamian health workers so that we can serve the public accordingly. So you can't have loopholes or gaps in the system, not fix those, and then expect us to move forward and provide the type of care that Bahamian public will be expecting.
The BDU said it finds itself in a most precarious position, as it would like to support the government fully, but it must first advocate for its members, patients, and the general public at large, and it offered its own recommendations. The BDU said government should slowly implement NHI over a period of 5 to 10 years, with the initial phase focused on infrastructure improvements, administrative and system development, further research in healthcare-related fields, as well as the education of healthcare workers on the initiative's goals, expectations, and presumed outcomes of NHI. Patients should be educated as well.
We also want to encourage patient education because we know that this is the foundation for NHI to move forward and for it to work effectively. So if the patients are properly educated and the population is not educated appropriately, there's going to lead to more confusion. And so, although as doctors we try to educate our patients, we know that this should be a national-wide educational program, not just on the scheme, but we should be looking at healthcare as something that the entire country should be taking part in, especially with our high rate of obesity in this country.
The union also called for greater emphasis on stakeholder involvement, a robust investment in healthcare technology, the removal of taxes on medical equipment, medication, insurance, and care, and focused primary care objectives led by primary care physicians and providers.
We are for the concept of NHI and universal health care. We want to support a system that's going to be beneficial for the Bahamian people, but we also want to be included in this, and we want to be able to have a scheme that's going to work in the future and not something that's going to fall apart.
Reporting for NB12 Weekend, I'm Dana Smith.
Well, Prime Minister Perry Christie announced earlier this week that his administration has signed contracts to remediate clinics throughout several islands in the Bahamas, which would be a major component for growth in the country. These comments came at the 2016 Business Outlook Seminar as he addressed the business community on pressing issues in the Bahamas, including national health insurance. Simone Davis reports.
As the Prime Minister spoke about the incoming of national health insurance and ways to strengthen the healthcare system in the Bahamas, he acknowledged that there is a great need to remediate inefficiencies in hospitals and clinics, mainly in New Providence and Grand Bahama.
I'm on the subject, and so that you know the reason why I have not put charges in place yet, because I want Bahamians to see the benefits that are coming. We're going to contract to remediate Princess Margaret Hospital now, to remediate the RAND, to strengthen the clinics, to be able to provide wonderful medical evacuations, to perfect the many hospitals in the islands. We're doing all of those things now, and people will see and feel.
Christie said although the challenges to strengthen the healthcare system are profound, his administration is taking bold steps and making major investments.
We believe it's going to be a major component, not what people say, a major component for growth. Because you will see that from preschool to adulthood, we are launching a massive campaign on healthy lifestyles. And it's going to all be played out publicly. It's all going to be in all the newspapers and all the television stations and everything else. But because it is a decision calculated to foster growth.
Amid concerns and questions about how national insurance would work, many medical officials have expressed concerns over the hazardous conditions of the clinics and hospitals that they work in. Christie asserted that he is aware of those issues and is taking the time to deal with them as NHI draws near. However, he said the plans would only work if there is honest conversation. Amid concerns and questions about how national insurance would work,
comes at a time when we look at the history of Canada and how they introduced it. They didn't have private insurance. So therefore we have to have a paradigm that suits and fits and applicable to what we have here in our country. But it has to be done, ladies and gentlemen, by men and women sitting down together and talking to each other.
Reporting for NB12 Weekend, I'm Simone Davis.
Now on a lighter note tonight, just take a look at this spread of delicious food. It's enough to tantalize any taste bud, except you can't really eat this food, and if you could, you'd finish the meal in just one bite. They're the creation of aspiring journalist and artist Carissa Rowe, who discovered the art of creating tiny food out of polymer clay when she fell down a YouTube rabbit hole one day.
One day I was on YouTube, and you know, the YouTube, you search, and I end up coming upon a video of a guy who was actually making edible food that were this small. So one click after the other, I actually found a polymer clay tutorial, and because I'm familiar with polymer clay, I did like a sculpture before, so I'm like, this sounds interesting. So I watched it, and I had some polymer clay lying around anyway, so I'm like, you know what, I need to try this. So I made a loaf of bread, and after that I'm like, I want to cut the loaf of bread, but I was too scared, so I made another loaf of bread, and ever since then I was just making, I couldn't stop.
And the rest is clay culinary history. Rowe, who has no formal art training and calls herself naturally artistically inclined, said she became addicted with creating more dishes in a variety of cuisine, even tackling the intricacies of Bahamian food like cracked conch burgers, coconut and pineapple tarts, conch salad, and sheep tongue sauce.
All of them really have their own thing, I guess, but for me, my favorite one was the sheep tongue sauce, mainly because sheep tongue has such a weird color, and I was like, okay, if it's too brown, it's not gonna look good. If it's too gray, it's not gonna look good. But I kind of nailed the color, because coloring for me is one of my biggest struggles, I guess, because you know, with food, if it don't look good, then people ain't gonna eat it. And especially with these, since you can't eat it, you have to make sure it looks really good. So yeah, for me, coloring for me is more difficult than actually texturing it, but so far the sheep tongue sauce was the one I was like most proud of because I nailed it.
She's mastered the art of Japanese cuisine like sushi and American favorites like this dish, classic turkey slices with mashed potatoes and corn on the cob. Paying attention to the smallest details. It was enough to catch the attention of the popular global website BuzzFeed, which recently featured Rose's work.
I was kind of surprised at first, but it's a very short story. A friend of mine on Facebook knows someone at BuzzFeed and was like, hey, I showed my friend who works at BuzzFeed your work. She wants your contact. Can she contact you? And I'm like, what? Sure, whatever. And then that's just really it. And then after BuzzFeed, then other people started to reach out. So BuzzFeed really started the whole...
Rose says she sees a future for herself in the tiny food market and hopes to satisfy the curiosity of Bahamians and tourists with her creations.
I actually want to start doing little trinkets because I already made some keychains and stuff for family and friends, but I want to do like magnets, more especially from the Bahamian food so people could kind of relate to it more, because it was actually the Bahamian food that started people getting really, really interested in it, because I think more people saw, okay, well, mini sheep tongue sauce, mini kung burger and coconut tarts and stuff. So I do want to actually do little trinkets and stuff like that so people, especially locally, could enjoy and purchase and like, okay, that's Bahamian food, I can relate to it. So whether it's just magnets, keychains, and also there are people who just collect these things. I have people who reach out to me because they are into like miniature food and doll houses and stuff. So they just want it just like that. They don't want to have it for any kind of practical, logical reason, but that's okay with me. I don't mind.
And next up, Rose says she's tackling tiny Mexican food.